Hi and welcome. Today we are joined with Hamilton Baden, who is the EVP and General Manager of Heritage Health Solutions. We'll be conducting a Q&A about the great work that Heritage is doing in the healthcare field. Before we do that, I wanted to take a moment to introduce Validation Institute, why we're working with great solutions like Heritage, and then we'll kick off the interview with our first question. Validation Institute really is in place, and we're uniquely poised to empower healthcare buyers and advisors with critical information and data to help drive down healthcare costs and create better outcomes. We are in a position of providing transparency to support more informed decision-making for buyers and validating the marketing and performance claims of solution providers like Heritage to help support accountability and transparency in the marketplace. So we're thrilled to partner with great solutions like Heritage and be able to take this opportunity to share what they do. So I'll kick off with the first question and then turn it over to Hamilton to answer it. I think it's important, Hamilton, that you tell us a little bit about Heritage Health Solutions and why the Validation Institute partnership is so important to you as an organization.
Well, thank you, Sue, and thanks for having me. So Heritage Health Solutions, we're an integrated healthcare management company. We do a lot of work in the public sector and starting to do a lot of work in the commercial world. Really, one of the things we're focused on now is we've created a innovative and comprehensive solution for suicide and substance misuse. And I was introduced to the Validation Institute a couple of years ago and was just really taken by the great work that you guys are doing. You know, you mentioned words like great solutions, accountability, and that's just who we are and what we're all about. And, you know, I think I share the same dream that you guys do, is that when individuals are going out and they're trying to find a solution, that they can look for a stamp of approval or a seal from the Validation Institute, and they know what they are getting is the real deal, and it's worth the money. And so we support that same mission.
Excellent, thank you for that. And I know part of what you all tout is that you're game changers, and I do believe, based on the work that we're doing with you, that is true. You're leading experts in the suicide and addiction support. So tell us a little bit about how you got there.
Yeah, you know, there's really two stories and two journeys that came together in one. So from a business perspective, Heritage, over the years, we've been in business for about 15 years, and we do a tremendous amount of work with veterans and also individuals that are incarcerated. And when you look at those two groups of people, not a lot of people connect the dots. Unfortunately, the dots connect in a not so great way, and that's all around suicide and substance misuse. I mean, 22 veterans in this country commit suicide or die by suicide every single day. We've thrown $300 billion at the problem, and those numbers have not changed. A large majority of those individuals have substance misuse issues. And so we really looked at the problem, not only in those two populations, but also in the general population, and the numbers are just daunting, and they're growing. The pandemic has caused those numbers to escalate even more out of control. So that's from a business perspective. From a personal perspective, I've been a healthcare executive, been in healthcare for 27 years, and have been through my own personal journey. I'm a recovered alcoholic, got sober the traditional ways about 8.5 years ago, and it changed my life in a positive way and made me a better father and a better husband and a better businessman. So those two things have kind of come together to help us create this solution and hopefully help a lot of people that are struggling and also their families.
Terrific. Thank you for that. And so to your point, I think there's a lot of challenges associated with what you're doing in getting to a population that needs this help. What are the biggest challenges you see in the treatment of these diseases?
Yeah, the biggest challenge without question is, out of all the people that struggle, only 10% ever go get help. So there is this, I guess it's a theory, or it's just the way that we've treated people for so long, that you know, people really need to get in enough pain that in order to get out of that pain, they're going to raise their hand and they'll ask for help. And unfortunately, only 10% ever do that. So everything that we've built in this country for suicide, for substance misuse, it only gets used is if somebody gets pushed or thrown into treatment, or if they raise their hand and admit they have a problem, and people won't do it. And there's really two reasons why. It's it's stigma number one. This disease, there is so much stigma associated with it. Half the country believes it's a disease, the other half of the country doesn't, and they believe it's a behavior. And so people do not want to talk about it. They don't want to call themselves out and admit that they're struggling. The second reason that people don't get help is because the cure is too daunting. I mean, how do you cure substance misuse? Well, it's pretty simple. You just quit. Well, that's just not a simple task for someone that's in the throes of this. And so that's really the biggest challenge. We have to figure out a way to get to people and get them started on this journey before it's too late.
Right. And I know just based on our conversations, you have a few modalities in which you do engage folks, but tell us a little bit about, as we talk about Heritage Cares and how that's different from what's been done in the past, and what makes it so innovative with regard to solutions in the market today.
Yeah, well, I appreciate all those comments. I mean, first of all, we've created a 3-part program. It starts with the learning management system. So it's education, number 1. It's a care or disease management, number 2. And then it's basically, I call it peer coaching on steroids, number 3. And what makes this program different is what we're really trying to do is we're trying to start this journey sooner. And so our learning management system, which is called U-Turn, is a confidential platform where people can go, very much Netflix-like in nature. They can go and they can watch video content to start to learn, to get hope, to get advice without that fear of stigma. We will never call people out and go back to leadership at a company or an organization and say, Sue watched 10 videos about someone struggling with alcohol, or Sue watched 10 videos about a husband that's dealing with cocaine issues. And so again, we're trying to get that 90% of people and their families that are struggling that will never raise their hand to start their journey sooner. Once we do that and we start to build that relationship, we go through an assessment tool where we really establish what the risk levels are, and then we get them to a peer coach. We call them assertive community engagement specialist, and their job is to really help that individual through this journey, through behavior modification, harm reduction, and connect them to additional care if they need it. So it's a very different way of looking at this problem than just black and white. You have to quit and that's the end of it.
Right, exactly. There's so much more to it. And to that point, I know you talked about the demographic of folks and the areas of focus, but when you talk about your quote unquote typical customer, talk a little bit about that image and what benefits, how they can benefit most from your services.
Yes.
Veterans and incarcerated folks, but tell us a little bit more about that.
No, that's probably the most loaded question you're going to ask me because it's the hardest question to answer. In my 27 years of healthcare, I have never had a product or a service that there is no shortages of places that can use this. Every company, SAMHSA says that 46% of Americans in this country struggle with substance misuse. And there was a recent Gallup poll that said 18% of American workers in this country go home to addiction. The most fascinating part of that is there was a Snyder Health Institute study that said out of family members of addicts are 5 times more likely to be hospitalized in a given year. So it touches everybody. I mean, it's hardly anybody that you can't talk to that either has struggled with this personally or that has a loved one or a close friend that has struggled. And so commercial businesses, they may not think they have a problem, but they do. And the reason they don't think they have a problem is because a lot of people aren't raising their hands, which we've already established why that is. So it's the public sector, it's the military, it's first responders, it's commercial businesses, it's insurance companies. There's just no shortage of places that have this need and that we can help and just start this journey in a very different manner.
Yep, perfect. And you're 100% right that so many people can benefit from this. And it is truly a family disease, as they say. So tell us a little bit about how COVID-19, obviously we're in the middle of a pandemic, how has that contributed to the need for your services?
Wow, I guess I lied. That's the second loaded question. It's really hurt in 2 ways. And it's not hurt us, it's actually hurt the individuals and the family members out there. So because of the pandemic, people are stressed out. People don't know where to turn for help. There's a lot of uncertainty. And the incidences of substance misuse, substance abuse, and suicides are literally through the roof. It's one of the highest it's ever been in this country. I didn't even think it could go higher, but it has. The second part of that is the normal way we help people is face-to-face interactions. So you raise your hand, number one, but then you have to go somewhere. You have to go to an AA meeting. You have to go see a behavioral health counselor. You have to go to rehab. And a lot of those places, when we can't do that anymore like we used to do it. So people are, not only are people struggling more, but the normal way we help people is less accessible. So we really need a solution that's virtual, number one, and that's confidential so that people can start this journey in the comfort of their own home, over the phone, on their computer, without that fear of reprisal from anyone, really. So that's what has really been a benefit to us, is our program matches all of those needs right now.
Right, very important. Now, when we look forward, key trends for 2021, what are you keeping your eye on specifically in the healthcare benefit space?
Yeah, I mean, wellness is always really been a topic, but that's kind of like a loaded word. I will tell you that we have started to have a lot of people reach out to us because of these very issues that I'm talking about. There's a tremendous healthcare cost associated with individuals that struggle with substance misuse. The problem is it's very hard to find these people in the data. I mean, and I'll use myself as a perfect example. I mean, 9 years ago, I saw a psychiatrist every month. I saw a counselor every week. I was on antidepressants. I was on anti-anxiety. If you looked in the data, you would think I was a hyperactive person that was really stressed out because I worked too hard. But then when you really dug in and learned about me, once I got sober, guess what? All of that healthcare cost went away. So I think, you know, people are, we're seeing in the healthcare space is people are trying to figure out ways to help their employees and give them things that will, you know, make them stay at their job, make them more productive on their job, make them show up for work, and make their life better. And so that's really what we're seeing. And you know, being virtual, obviously with the pandemic, it's kind of changed everything, and it's really accelerated this virtual care continuum that we're all looking at right now.
Absolutely, which, you know, I think dovetails nicely into the last question that I have for you, Hamilton, and that is around, you know, ultimately our missions are aligned in a few important ways. You all are in the, you know, the space to help reduce costs and improve overall patient care. We're helping with transparency and accountability for solutions like yours, so folks know who to go to and why. But your company is obviously currently pursuing validation. Why is this so important to you and your organization at this point?
Well, I mean, you know, Sue, it goes back to what we talked about in the very beginning. You know, my dream is that when people go out to buy healthcare services, there's something that, for lack of a better word, validates the companies that they're looking at and proves that what they're doing brings value. You know, so many times in this world, you know, if you got a good marketing department, you can say whatever the heck you want, and you know, people have to go out and buy it, and they have to experience it, and they have to see if it really works or not. And so for us, you know, the Validation Institute has incredible relationships with some of the leading companies across the world, and we're trying to do something very different. We're not only trying to sell a product that can help people, we're trying to change 45 years of the way that we do something. I mean, it's a difficult, I mean, the journey for people that struggle with substance misuse and suicide has been treated the same way for 45 years. It's very simple. Hit rock bottom, and then when it gets bad enough, you raise your hand and we'll help you. And there's no scientific evidence that that works. It's just what we've done for 45 years. So we're always looking for great partners that are innovative and think outside the box and are transparent and can really lead us to get to as many people as possible to do what we're here to do. And that's make people's lives better and make people live longer and reduce healthcare costs. So it's an obvious fit for us. I knew the second that I met you guys and came to my first meeting that we had to be involved in what you guys were doing.
Thank you. That's terrific. Appreciate those comments. And I appreciate your time. And thank you so much for not only what you're doing in the space, but for sharing your story and for being such great partners. We appreciate the partnership for sure. And for anyone who's watched this, if you'd like any additional information on Heritage Health Solutions, Validation Institute. My name is Sue Morell. I'm the general manager. You can go to www.validationinstitute.com. Thanks for joining and have a great day.
Awesome. Thanks, Sue.